I think the most exciting thing is that the medication, the treatments that are being developed are better than anything that has ever existed. InStep Health is the nation's largest point of care media network. We have the ability to host marketing programs for OTC and pharmaceutical manufacturers in 30,000 pharmacies across the country, CVS, Walgreens, Rite Aid, you name it, as well as 190,000 physician offices. What we do every day for our clients is we get them in front of patients and then providers, physicians, pharmacists, other types of healthcare professionals, to make sure that they're educated about our client's healthcare solution, whatever that is, whether it's a new treatment, whether it's a device, whether it's an OTC treatment that someone can just pick up at one of our pharmacies. So when we think about unique data that InStep Health has access to, we use that data for two purposes, which is to target our programs to make sure that we are in front of the right patients or physicians in the right pharmacies, in the right doctor's offices, and then to measure those programs to show that that it provided lift, that the client got a good ROI. So one of the unique things that we have is, due to our partnerships with the biggest pharmacies in the country, we actually have access to I believe it's 3/4 of all of the RX treatments in the country flow through data. So what that means, Andy, is if we're programming programming an initiative for someone that is looking for a specific type of diabetes patient or a specific type of psoriasis patient, we can actually look across our network and program our client into the highest indexing stores or pharmacies that we have among our 30,000 pharmacies, as one example of the type of data we have and the way that we use it.
Dan, let me ask you about the data signals that you collect, the scope of it, and why that's valuable to marketers.
Sure. So one of the things that's unique about us is we have access to these big sets of data from the nation's leading pharmacies, the CVS's, the Walgreens of the world. And that allows us to both target and place our programs into the pharmacies that index the highest for certain conditions, and also in the back end to measure the programs so that we see that a given client got a significant lift in ROI from that program. About a year before we met the Deep Intent folks, we started to create a digital overlay on top of our in-pharmacy and in-physician office programs. We immediately started to see that added media layer was getting good results for our clients, that we were getting greater lift when we added digital on top of those tactile tactics, if you will. But what we wanted to do and what we came to Deep Intent for is, particularly on the pharmaceutical side, those marketers are looking for more and more specific groups of, I guess, patient subpopulations, you might call it. And Deep Intent had developed an audience model technology to look into, in a HIPAA-compliant way, to look at things like ICD-10 codes, to look at things like NDC codes of treatment, and to create very specific audiences based on that anonymized, tokenized data. So in theory, it sounded like a great idea, and so we started this partnership. And then when we started to see it happening in the field, we were really excited because the results started to look really good. So that was very attractive to us. So in theory, we're like, wow, wouldn't that be great if we can be in exactly the right pharmacies, in exactly the right physician offices, but also have our digital targeting just be at that next level. Everything that we do to measure our results We always use a third-party research firm, and we always do a test and control methodology so that it's gold standard, scientifically rigorous. So that's the first thing that we do is we set up our footprint of our media campaign such that we have a test and control going on. We looked at that data and we saw the test versus control. When you backed into what the client paid for the media versus the amount of treatments that they got back incrementally, we were actually at a 9-to-1 ROI. So it was a complete home run because we had the right footprint, the right in-store and in-office tactics, and then also this great digital campaign happening on top of it. I might live to see cancer as a chronic condition, and that is very exciting. And then what we're doing as healthcare marketers is we're finding the right patients that are appropriate for these very specific treatments. So I think that the exciting part is that the medicine is getting better than it's ever been. The challenge is that those medications are for a narrower and narrower group of people. And that's where healthcare marketers like us and InStep Health and Deep Intent are coming into the equation, because we're bringing this message, this education, this message of hope that if you're suffering from X, Y, or Z, there might be the perfect medication out there or the perfect device or what have you that can help you feel better, right? So that's what gets me excited. 9-to-1 is a home run any day of the week. So we were excited about those results. But on this particular campaign, we had a second third-party research study going. And on that side of the equation, we found it was a study of audience quality related to the digital targeting. And it found that the Deep Intent model to find this particular group of patients was 2x the average of all the other digital media properties that were trying to help this particular client reach this patient subpopulation. So we had this great result for the campaign overall, and then you were showing the client that the digital portion was just blowing away most of everything else on their media plan. So it wasn't just a home run, it was like a grand slam, and that was really exciting.